Guess what, guys? Today is the first ever World Dense Breast Day, and I am here for it. So let's talk about breast density and why you should care about it. For starters, breasts are composed of fat and fibroglandular tissue, which is the milk ducts, the glandular tissue, everything else. The more glandular tissue a woman has, the more dense breast tissue she has, and the whiter her breast will appear on mammogram. Dense breast tissue is normal and common. Actually, about 50% of women have dense breast tissue, including me. The problem with dense breast tissue is that it can obscure small cancers on mammography. Dense tissue is white, and breast cancers are also white. Think of it like finding a snowflake in a blizzard. Because breast cancers are harder to see in women with dense breast tissue using mammography alone, they tend to be larger and at a later stage. In addition, having dense breast tissue increases your risk of developing breast cancer. The more dense tissue you have, the greater your risk. The good news is that by adding supplemental ultrasound or MRI to your annual mammogram, depending on your risk factors, can help us radiologists detect smaller cancers at an earlier stage. The downside of any supplemental imaging is that we might find a mass that warrants a workup or a biopsy, even though it's not cancer, but we can't tell that from looking at it. Luckily, most imaging-guided procedures are minimally invasive, not that painful, and allow us to tell for certain whether it's benign or cancer. So how do you find out your own breast density? That's a great question. The only way to know your breast density is actually by reading your imaging report. There will be a section called breast composition, and the radiologist assigns you one of 4 breast density categories. C is heterogeneously dense, D is extremely dense, and those are the 2 categories where women would benefit from supplemental imaging, such as ultrasound or MRI. So if you have heterogeneously or extremely dense breast tissue, you may benefit from supplemental imaging. Currently, 38 states have some sort of breast density notification laws that inform women that they may have dense breast tissue, but the language is often confusing, and they don't clearly state a woman's personal breast density. Additionally, only 14 states and DC have some sort of mandatory insurance coverage to cover these supplemental imaging tests, which means that far too many women are missing out on technology that could potentially find their breast cancer at an earlier stage, further worsening breast cancer disparities. Katie Couric just this morning came out with her breast cancer diagnosis story. She, like many other women, has dense breast tissue and put off her mammogram because of the pandemic, and a supplemental screening ultrasound showed a small early stage 1A breast cancer. She's gone public with her news to encourage other women to learn about their own breast density and encourage them to get their mammograms that they may have been putting off because of the pandemic. I am so happy that she is sharing her story yet again to help others. I encourage you to find out your own breast density by reading your mammogram report and talk to your doctor to see if supplemental imaging is right for you. There are many amazing resources out there for women with dense breast tissue these days, including densebreastinfo.org. Also, read Katie Couric's full story where she talks all about this. Thank you for coming to my TikTok TED Talk. Did I just make that up? Follow the Booby Docs for more of the breast information.